you. Today, we have a very good eminent resource person, Professor Vijay Reddy Bandali. So he will elaborate about the career opportunities in nursing, a global scenario. He is having vast experience in the field of nursing. He has 12 plus years of experience in India and abroad in teaching, diploma, UG, PG, and many more other courses. He has completed his MSc and BSc Nursing from Rajiv Gandhi University of Health Sciences, Bangalore, and he has worked as a tutor, lecturer, assistant professor, associate professor, and principal too. So he has officiated as a nursing superintendent in his career. He has many more certificate programs, certificate courses in BCLS, ACLS, BLS and ACLS, and certificate course in diabetes educator, and also in first aid and emergency. And he has been selected as an editorial member for numerous publications at national and international level journals. And also he has worked as a resource person in national and international level workshops, seminar, conferences, and he has published more than 50 research papers in various national and international peer-reviewed journals. And he acted as internal, external examiner for UG and PG students in different universities. He has received Young Scientist Award from DKIRF Research Society, nominated twice for honorary doctorate, received Best Teacher Award in his career, appreciation certificate from Government of Maharashtra for his contribution as a coordinator for tuberculosis awareness program at Kolhapur district in 2012. He received first prize for his presentation in national conference as a research methodology at Uttarakhand. His other interests include participating in quiz competitions, essay writing, and he has organized many extracurricular activities for his UG and PG students. He is an editorial review board member for various international and national journals such as USA, UK, Australia, India, etc. He is a board of studies member for various eminent institutions and universities. All acts in social media concern to research activities such as 400 plus citations to date, 6 lakh PPTs viewed and downloaded by the faculty and students across the globe in SlideShare since last year. Involved in social activities such as adopted animal from zoo, monthly donor for UNICEF, donor for orphanages, old age homes, and constant blood donor. Worked at flood relief centers for assisting the needy people. So we have a versatile resource person today and a good friend of mine. And presently working as a faculty in ESIC College of Nursing, Gulbarga, Karnataka. So thank you, Vijay, for accepting our invitation as a resource person of today's one of the very best topic for the nursing fraternity, that is career opportunities in nursing at global scenario. So I hope that you are the best person to speak about this because you have well worked in the past about this matter, and also you have very good experiences in India and abroad. So therefore, we assume that we are the best faculty for elaborating about this career opportunities in the nursing, and it would be a greater opportunity for the viewers today. So over to you.
Thank you, sir. Thanks for introducing me in brief with almost everything covered. And I'm very thankful to you first and foremost for providing me an opportunity to present this topic through your renowned university. So I start my presentation. And today's topic, as we all aware about the career opportunities in nursing global scenario. So here with concerning to the nursing profession, as everyone knows, many kind of job offers available in India as well as abroad. But how much reliable it is, how many people are getting it, and how many people are getting benefited through this kind of opportunities? Because everyone says nursing is having endless opportunities. So which are those opportunities we have in India and we have in abroad? So today we will discuss in detail. So let's start with the WHO General Director General has given a statement last year that nurses are the backbone of any health system. Today, many more nurses find themselves on the front line in the battle against COVID-19. As we are going across the pandemic, deadly pandemic right now, in many states of India, almost many parts of the world. So this pandemic made nurses, opportunities still more, day-to-day life. And now the value of nurses comes in the mind of public. The image of public also changed because nurses are working 24 into 7, directly exposing to the patients of COVID-19, as we are aware. And most of the time, as you know, the COVID pandemics, nurses are exposing directly to the patients. So now everybody comes to know what is the importance of nurses, how they are dedicating themselves to the health services. So let us see today in the 21st century, we have a nursing career in a different aspects. So we can work across world, sorry, across the world in many fields like hospitals, like community centers, and many more things. So let us see what kind of statistical information we have, how many millions nurses are required at the present situation in India as well as abroad as per the WHO. So let's have, before that opportunities, we will have what kind of qualification is required to get these opportunities. As we all knew that we have some qualifications to get past, then we are able to get the opportunities to work or to enter the nursing practice. So ANM is a basic qualification. These people used to work ANM nurses at the level of midwives, I mean taking care of mother and all, and GNM diploma programs. And nowadays GNM diploma program is getting down towards the decline because of baccalaureate students, BSc postgraduate students are more and more. So peoples of abroad are demanding the minimum graduate nurses. So GNM is getting down in present days. And PG diploma courses, MSc nursing, MPhil, PhD, postdoctoral courses, and certificate courses, fellowships. These are different levels of qualifications in nursing. So we should have a better qualification, and then we can go for the jobs. So as per the WHO, we have certain facts here. So let us see. It's a as mentioned WHO, nurses and midwives account for nearly 50% of global health workforce. As everyone knows that we, the nursing personals, are 50% of any healthcare services in the world or in India everywhere. So this much big workforce, man force, okay, and these are working in various levels. So let us see here. Sorry. Okay. And the WHO is already, it's already announced that 9 million nurses required every every country, including every country by the year of 2030. That is near about 1 crore nurses approximately required in the world, every part of the world, and mostly developed countries and including underdeveloping countries also required huge number of nurses. And what nurses are having compassion, what nurses dedication. So because of that, WHO has honored last year the year of 2020 International Year for the Nurse and Midwife. This year that 2020 was dedicated for the nurses, those who are working tirelessly without thinking of their health risk in the health sector. Let's have some discussion regarding the WHO investment. They have said urgent investment is required. What kind of requirement is in the health services? That is, they have clearly said $100 billion investment is required for the healthcare personnel, especially for the nurses, upliftment, nursing, different kind of nursing courses development, skill development, and different aspects of nurses. Here in the WHO, along with the ICN, International Council for Nurses, they have, they have mentioned 28 million nurses required worldwide. That is, in the year of 2013 and 18. And but we don't have that enough nursing personnel, and we are lacking, around 5.9 million nurses shortfall. We are having, just less than the requirement, and especially at least per thousand population the nurses requirement should have minimum of 2.5 to 3, but most of the countries we don't have that 2.5 nurses per thousand. For example, in our India we have hardly 1.5 nurses per thousand population. That's why the world health organization says India alone requires 3 million nurses at urgent, and across the world it goes up to the 6 million nurses by 2030. It's approximately 60 lakh shortage. And here we have to go through the WHO details given for the shortage of nurses in this article. That is, 80% of the world's nurses work in the countries that home to half of the world's population, and one in every eight nurses practice in country other than the where they born. It means every eight nurses, one nurse is working abroad. I mean, where that's away from their native country. That is one nurse every eight. It means you can understand how nurses are getting opportunities in abroad, working, okay, and in their own countries, and none other than nursing professions are working in abroad like huge ratios. And in upcoming years, there is a huge shortage due to the aging for the nurses, and maximum nurses are retiring. It's approximately 25% nurses are going to get retirement in the next 10 years. So the world has to get ready with the that shortage, and they have to get fill up with the next 10 years. And various job opportunities as we are discussing, it's like many industries, many hospitals, research areas, administration, nursing colleges, military hospitals, UPSC exam. There are so many plenty of opportunities for nurses. For example, hospital, as I said, in hospital there were many sub areas or super specialty areas like nurse anesthetist, which is high demanded a super specialty nowadays, and this is the highest paid in the world, especially in the USA and UK. The highest paid super specialty will be the nurse anesthetist. Okay, so that kind of the different capabilities, skills nurses are developing, and that would pay highest salaries, highest better facilities for the nurses. And industries also, every industry it is mandatory that nurses has to be present, at least depend on the industry size or the manpower working, the nurses are required. Every 200 workers, the one nurse, occupational nurse should be present. And along with the research activities nowadays, like ICMR, there is a plan for ICNR with the many kind of TNA and other organization force the government to go for forming or framing the ICNR in India. Through that ICNR, many kind of research activities could be able to possible to make evidence-based nursing practice still more. And administration, as you know, administration nowadays it's gaining more responsibilities, more facilities providing and getting lot of attention in the hospital or in the nursing colleges, wherever nurse administrators are there, not only limited to the nursing colleges or hospitals, but also universities. As you know, one of the nursing personnel who is appointed as VC, Vice Chancellor in Northeast University of India. That is the best example we can say. Nurses not only having the boundary to work within only hospitals and nursing colleges. Beyond that, also we have opportunities to work and prove ourselves because nurses are highly caliber and nurses are highly dedicated comparing to the other professions. This is the one example I given. Nursing colleges as well, the many renowned persons are working in nursing colleges to bring out the best students, to provide the best nurses for the society to serve themselves. And UPSC exam I have written here particularly, not only for hospitals or colleges or nursing related institutions, but UPSC exams also nurses are having, capability to pass. For example, last 5 years ago, one of the nurse who is from Kerala, Miss Anis Kanmani Joy, who was cleared UPSC and now working as a DC in one of the district in Karnataka. So that's a better example. Not only nurses are limited to the only hospital or nursing institutions. So this kind of exams, this kind of competitive exams, most of the peoples can try it. But in the research activities, nurses have to be work still more hard to gain evidence-based nursing practice. So here, registered nurses getting lot of chances to work, many more opportunities to work in the hospital in different settings, different areas. As I mentioned here, skilled nursing facilities, outpatient settings, physician offices, clinics, insurance companies, government sector, community health, elementary or high schools, that's the school health nurse, and universities, and along with this, correctional healthcare facilities. These are the registered nurses can able to work in most of the areas. And along with this, another more attention fields are now emerging. For example, that is clinical nurse educator. Recent years in India, many educators requirement is there in the hospital, especially nurse educators. If the hospital is having, they can teach the nurses, staff nurses, nursing officers in a better way. Hence, the care given to the quality care given to the patient will be much more better than the previous one. So now it's a more attentive nurse educator, designation across the country as well as in the abroad. Abroad, it has been started 10 years ago, nurse educator, but in India, now private sectors are appointing nurse educators more and more numbers. And public health nurse, as you know, public health nurse here, so-called community health nurse, and community health nurses are having huge opportunities. For example, I could say in India now, that is MLHP course, mid-level healthcare providers, then CHOs, okay, both are same, community health officers. Government is appointing a huge number of graduates. Minimum qualification for this will be a graduates, and lot of peoples are getting appointed, and they are serving for the periphery level healthcare services in the villages, and hence they are serving for the people's health in the prevention and as well as promotive care, even in the treatment. Home health nursing, as we all know that home health nursing is not much prominent in India, but it is more prominent in Europe countries and USA and Middle East countries also, because most of the peoples required home health nursing in abroad, and it is one of the leading paid super specialty. Then travel nurses are gaining, attention nowadays. Travel nurses like air, train, and even in the long term buses. And now travel nurses are working hard and getting attention. Forensic nurses are working in the forensic labs and many kind of research institutions, criminal labs. These kind of nurses are highly paid profession, highly paid super specialty in our nursing profession. And nurse advocate, as you know, this is also neglected in our India, but it is highly paid profession, highly paid super specialty in the Europe countries. Hospice nurse, again, we have community. This is a role we merged in the community health nurse in India, but hospice nurse is separately they are appointing in Middle East countries as well as Europe countries. Telephone triage nurse, it's nothing but telephone triage. It's a telenursing in the sense. So they used to call and they have to pay online. They will give some guidelines, they'll give some instructions, they will give some health teaching through the phone itself. And nurse writers, they are nothing but writers. Nowadays it's a different and super specialty, it's going on, and a lot of attention is having towards nurse writers. And these job is getting highly paid, one of the highly paid in again abroad, because nurse writers main role is to publish the papers, to conduct the research, to evidence based practice, to support evidence based practices and apply the knowledge whatever whatever the findings, that will be applied to the clinicals. These roles can be performed with many other super specialties nurses. And as along with this, some bachelors still having some super specialty roles, that is infection control. As you know, this word is more common nowadays. Infection control nurse, ICN. This is every private hospital is having except government hospitals in India, especially state government hospital. This designation is not provided and not appointed. But in the central government hospitals like AIMS, PCI, now nurses are working and appointed for the super specialty. Infection control nurses are getting, a high amount of salary plus facilities in abroad. Quality control, and quality control is a new specialty we can say, but it's one of the super specialty has been started and working in abroad, and good salary has been paying for this. Case management, and here in the case management, especially the different kind of, cases, like as we say in India, MLC, medical legal cases, and different kind of operations, okay, and such kind of peoples, okay, will be managed by the nurses, super specialist nurses. And healthcare informatics, and these nurses are, getting paid very good salaries and very good facilities in the abroad. But this super specialty has not been, yet started in India, and it is very rare in the multinational hospitals like Apollo and all. It is there. Nurse manager, as you know, nurse manager in India, we have this role since many years. Nurse manager for the different areas like neonatal nurse manager, NICU, ICCU, so and so. And nurse managers are getting handsome salary with the better facilities. And charge nurse, it's similar to the nurse managers. And nurse educators, again, we have already dealt with the educators. These educators are getting good salary, and they are educating the nurses, nursing staff, seniors, juniors timely, and they are trying to improve the status of holistic healthcare. And here, career opportunities in abroad after masters, because in abroad, you get different kind of, segregations after BSc and masters, because after UC you get different kind of jobs, and PG different kind of, job descriptions. For example, I have mentioned very few with the most common job offers for the masters in the nursing degree abroad, especially. For example, nurse midwife, the one who specialized in the OBC in master's degree, they get job opportunities in the OBC wards, nurse managers, or neonatal wards, etc. And critical care services, the qualification for this is master's degree in the adult health, that is medical surgical nursing, and they can work in the critical care services as a case managers, or or as a kind of leader, team leader. Nurse instructors, this is like a, nursing college. They are like tutors, assistant lecturers, or assistant professor according to the cadre, and PhD holders they can have. And care assistants, here in the live care assistants are very important here, because these are specialized in the particular particular degree, medical surgical nursing, pediatrics, etc. Registered nurse, RNs, again, these people after masters, they get very handsome salary, especially in Canada and US. CDC nurse here, as you know, Center for Disease Control, that is one important part of the government of America. They used to appoint CDC nurse. Okay, these nurses' responsibility is very high. They have to maintain statistical information of diseases. They have to maintain, all entire nations, pandemics, or etc. These epidemiological details they have to maintain. They have to convey between the government, higher authority, as well as the peoples, community peoples, and they get really high salary. And it's compulsory master's degree minimum qualification is required for get selected for CDC nurse. Public health advisor, it is like a PHN public health nurse, and now master's degree whoever completed in PHN or public health, okay, they are eligible for getting this job, that is public health advisors. They are going to advise regarding the any kind of pandemics, any kind of vector-borne diseases, any kind of more common diseases among the community peoples. Their role is in prevention aspects more. Some countries, as we have gone through now regarding statistics, and which are the countries for the nurses recruiting more and more. First and foremost, Australia is having highest requirement now, and every year thousands of nurses moving to Australia, and along with the Australians are providing visa and green card for the Indian nurses and providing better salary packages. Especially the Indian nurses can get, it's approximately 60 lakh salary, 40 to 60 lakh salary in between every year with better salary. UK, as you know, lakhs of nurses working in UK already from India, thousands of nurses every year moving towards the UK countries. Norway, Netherlands, and Dubai, especially Middle East countries, now getting more attention, and they are paying better salaries. Middle East countries, especially Dubai, Qatar. Even I worked in Middle East country, and we used to get better salary and accommodation facilities and even food facilities during the working hours. And the peoples are treating Indians really better way. And after this Middle East, still more countries are there. That is New Zealand, US, Ireland, Canada, Luxembourg, Denmark, Switzerland, Israel, and Ireland. Iceland. These are the countries which are offering many more job opportunities every year. Many nurses from the India, they are moving to get their jobs in the mentioned countries. And also along with this, so many countries like other countries also require Singapore, Malaysia. So these countries are offering minimum salary nowadays to work. But this mentioned country, the highest number of salary nurses are paid one of the highest profession in their country, comparing to the doctors, equal salary getting in the US, the specialized nurses. Now it's we talk about our India now. It's around 6 million nurses required by the year of 2030, because healthcare sector is growing very vastly in India, very prominently, and much attention is required, and already gained much attention gained in nowadays due to this pandemic. And India already lack of 6 million nurses by the year of 2030. So this kind of statistical information, we can come to know how much nurses requirement is there, and how vast scope for the nursing profession is there in our country. So, as per SETI information, or the news has been conveyed to the government every year, the how many nurses are going to be appointed to fulfill this shortage of nurses, future nurses in India. So most of the committees have recommended to start nursing colleges, to provide permission for many nursing colleges to fulfill the shortage of future nurses in India. And till now, we have discussed opportunities of for nurses in abroad. So some opportunities we discuss with the concerning with our country, concerning with our India. That is, as you know, first and foremost, opportunity for nurses in India is government and corporate sectors. So that is corporate sectors. They are also paying huge salary with better facilities. So here, next I have written that regarding the CHOs, that is which I said, thousands of nurses, graduate nurses, as even masters who all completed in the master's degree, they also applying and getting jobs regarding MLSP or community health officers. And along with this, many other areas are there. Indian nurses can get job in India. That is DRDO, AIMS, as you know, everyone aims recruiting thousands of nurses every year, and new emerging aims are there in almost all states. Now it's around 16 to 17 aims are operating in India. In future days, another 10 aims are planned already sanctioned. So our students, our nursing personals can have a lot of chances to get selected for the aims with high salary. That is grade 2 and grade 1 nurses, as well as in the nursing colleges. JIPMER, PGI, ESIC, these are the big sectors, nationalized sectors, The central government will appoint thousands of nurses every year, and railways as well, military hospitals too, and competitive exams already we have discussed, and state governments like Kerala government recently around 8,000 nurses they have demand and they are fulfilling their by recruitment, and Maharashtra also many thousands of nurses they are appointing. This made the nurses getting easily the jobs, and usually nursing profession is a ocean of job opportunities, but still many more things are there to happen. And largest employer, nursing sector and especially health sector is the largest sector in the world, and among that nurses are half of the manpower in the healthcare sector. But here it is written, and we have come to know that World Bank has said it's approximately 100 billion remittance in the every year, $100 billion every year, and around shortage of 80.2 million health workers, including all the health workers by the year of 2030. Out of that 80 million, half of the nurses is required in the world. So we can come to know the importance and regarding the nurses job opportunities. And healthcare sector, it's like largest employer of women workforce in the world. In the healthcare sector, every country, if you talk about, the women workers are contributing more compared to the men. And here I mentioned some of my friends are working in US. They said which are the highest five states providing salaries for nurses, highest salary. So I come to know the first state in US is providing high salary for nurses. That is California. In California state, they are providing 1,13,000 US dollars per year. That indicates that equal to the amount of 1 crore rupees per year. So this is very good, handsome salary for the nurses who are working registered nurses in US. And second state of US is that is Hawaii. Hawaii also providing 1 lakh plus dollars per annum package for the nurses. And Colombia also same. It's near to the 1 lakh dollars per year. It means 75 lakh rupees Indian currency. They are providing nurses salary per year. Massachusetts, then Oregon. These are all providing $90,000 above per year packages. So this itself indicates the high demand of nurses in US, especially for the registered nurses as well as experienced skilled nurses. These are all I have mentioned here, some picks. This every year we get, I think you come across many ads in the newspapers, many ads in the electronic medias. So the nurses work for Australia, the nurses are getting ads for US, UK. These are all ads more common nowadays. This indicates that how important and what kind of job opportunities, endless job opportunities for the nursing personnel, especially for the MOH, Ministry of Health, Kuwait, Qatar, other Middle East countries. There are 10 to 15 countries who are appointing every month, and thousands are moving towards these Middle East countries for attractive salary and benefits. So now question is that job opportunities are there, huge, okay, fine. And here, what kind of qualities nurses, what all the qualities nurses should possess, okay, to get job opportunities in India or abroad. So there are huge qualifications, and along with the qualities must have, so that one can get easily the opportunities, one can gain the jobs, one can gain the opportunities to work in India or abroad. So because this is very important for everyone who is aspirant of nurses working abroad as well as in India, particularly concerning with abroad. First thing, as we all knew that qualification or license is must. The minimum qualification usually nowadays bachelor's degree that should have in nursing. That's the first qualification, first quality you should have. And next is urge to learn continuously. That is learning never ends, because the every year due to the advance in technology we need some different knowledges. Every year we have to update our knowledge, so continuous learning one must have, so that they can reach the destiny. Dedication, nurses should have dedication. Without dedication, nurses cannot work in the hospital, specially, and they cannot show their skills. And experience, as you know, you have to gain experience. That is one of the plus point for working or going to get job for the abroad. And critical thinking skills. Of course, this is required in the hospital who is working in the specially critical care wards, that is emergency wards, because less time nurses can have better thinking, and they can judge themselves regarding the care. Next will be the communication skills. What kind of communication skills one should have to reach a better job, to gain better job is whatever the country you plan, they have to gain the language essential skills in that way. For example, you have to go to Denmark, you should have skills in the Danish language. If you want to go to UK, you should have the English language. Okay, in the similar way, the person, the one who wants to go to the country, that country language, that country things. For example, if you want to go Canada, if you study French language, if you have at least B certificate and more beneficial. So in such a way, you should have language proficiency, and communication skills also include how you communicate with the patients as well as the surrounding. I mean, the colleagues working with you, different health personnel. Compassion, it's important that you must be compassionate towards your work, towards your service, wherever you just work for the college or hospital. And detail oriented, it's nothing but what you are assigned duties, you must have aware, and you must follow the assigned duties. That's the capability must have. Then emotional stability is must for nurses, because the such a pandemic time, the nurses' emotional stability is very important. They have to maintain better emotional stability in this kind of pandemics, deadliest pandemics, because you need to be emotionally stable, then only able to provide holistic care, nursing care to the patients. Organizational skills, one must have organizational skills to work better in the hospitals or nursing colleges. Physical stamina, as you know, we should have some physical stamina or adequate physical stamina to work in any kind of job settings. It may be hospital or college, whoever it is, but hospital peoples who are working in the hospital, those nurses should have more fit to work, because day and night shifts or continuous shifts sometimes, and due to this emergency, you should be able to handle such kind of things. So you require the physical stamina, you need to maintain physical stamina to work properly. Time sense time sense is important. As you know, we have to plan for the time, better time, and we should achieve that goal. We should have that satisfaction, or else we don't have time sense, and it's not possible to go for achieving anything, or any care in the hospital setting or personal thing. And consciousness of what you are doing. This is very important, that whenever the things done by the person, you should be more conscious what you are doing and what time is required and when to be completed. These all aspects, when person's consciousness is very much important and required to gain their destiny, to gain their knowledge, to reach their goal. Okay, these aspects, the consciousness is very important thing. And moreover, here, uh, with related to this job opportunities in the global scenario, one can have a lot of opportunities, especially nursing professionals having oceans of opportunities in almost countries, underdeveloping as well as developed countries. So nurses have to develop in a better way their skills, knowledge, and update their knowledge accordingly. And the specialty, super specialty, what they work, and they have to achieve that super specialty knowledge. And one must have super specialty thorough knowledge. Definitely they get very good salary, very good facilities in India as well as abroad. But most persons of India, they are having brain drain. That is nothing but they are attractive towards the many countries, for better salary as well as job conditions. As you know, in India we don't have much better job conditions because we have wherever we work we don't get enough facilities that one must have. But in abroad, when you go for working, you get all the facilities and you will be very satisfied to work their environment. They create such kind of environment to work with the everyone with other kind of department peoples. So the nurses of India, our young nurses and required the job required persons, they must be dedicated and all of them trying to work hard, and whatever the country they plan to go, they have to just do the background work for at least 6 months or 1 year. Except Middle East countries, the person want to go to Middle East countries, you need to have, you need not to write any kind of English testing exams, the IELTS and all. But in the UK and USA, you must have cleared with the IELTS and CGFNS, which is required must. And our Indian nurses, almost everyone should have that kind of qualities what we have discussed earlier. One must have that qualities to gain better opportunities of jobs in the country and abroad as well. So here we conclude the topic. So as we all come to know the opportunities, the requirements of future requirements of nurses in our country as well as across the world. So we have to be more aware and more competitive, and we have to go through the present knowledge as well as we should be prepared for the any kind of situation like pandemics or any kind of situations like future challenges, maybe the global warming, maybe the other kind of population explosion, so many things, future challenges nurses will face. So accordingly the nurse has to prepare well to face those challenges in the future days. So, Indian nurses, almost every country, Indian nurses having respect because Indian nurses are so dedicated, and Indian nurses are, highly sensible, and they are having the bonding, the relationship what we have, and they respect the abroad peoples are respecting more Indian nurses. They are preferring more Indian nurses comparing to the other nurses of the countries. But so meanwhile, the competition is nowadays quite high comparing to the Indian nurses. Philippine nurses are high in number of appointing in abroad. Along with Chinese nurses are giving tough competition nowadays. They are moving towards Europe and UK, US countries, Middle East also even. So our nurses has to go through the better training as well as developing the skills along with the present and advanced technology, advanced knowledge related to the specialty what they choose. Hello, hello,
Thank you,
sir.
Vijay.
Yes. So
Thank
any
you, Vijay,
more?
for thank you very much for elaboration on career opportunities at a global level. You have started with the WHO definition and its present statistics, and also continued with the various courses available in nursing and their job profiles, specialties in various in nursing, and various super specialties also highlighted along with that. And
Yes.
you notice on job opportunities in India and other countries, and specifically you mentioned about vacancies arises in state government and central government, as well as you said about the vacancies and opportunities available at abroad. In continuation, you spoke about the vacancies and their salary. Best part
Yes.
of it is you spoke by specifying the country and the state of India, and also you said about the criterias and the qualities required for the nurses to well prepare for to become a a successful nurse and to seek the good opportunities at India and abroad. So overall, it was very impressive, and I hope that the career seekers are definitely got an opportunity to build up a good way towards their career. So that thanks for receiving our opportunity and
Welcome.
making a good informative session on this day. So thank you
Thank
once
you, sir.
again, Vijay.
Thank you, sir. Thank you. Thank you once again. I thank everyone, especially Dr. Ravinder, sir, who has given me an opportunity once again to present this topic. And I thank all the organizers of this event. Thank you all. Shall I quit, sir, now?
Yeah, you can. Sir, can we wind up? Sir, can we wind up?